When your teenage child is diagnosed with functional neurological disorder, short for FND, that includes non-epileptic seizures, non-epileptic episode, whatever you want to call it, PNES, NES, the doctor recommends your child to see a therapist. As a dedicated parent, you should be thinking, why therapist and how to find the right therapist for your teen with FND. Let's dive in. Hi, I'm Dr. Lee here, a pediatric health psychologist and the founder of Teen FND Academy. For the first time that you're here, welcome to my channel. I'm going to talk about what FND is because that is my lifelong mission to have that awareness. So functional neurological disorder, FND, is an umbrella term to describe these cross-wired problems between the brain and the body, even though your child's brain and the body are structurally and physiologically, quote unquote, okay. It is a real diagnosis. FND is a biopsychosocial phenomenon, whereas conversion disorder was considered a pure mental health diagnosis. That's why there's still a lot of stigma around FND. People don't know much about it, even though it's a very common diagnosis you would get in a neurology clinic. Anywho, why therapist? So, as I mentioned, FND is a biopsychosocial phenomenon. Therefore, the first line of treatment always starts with a psychotherapist. It is not to say that FND is a psychological problem, but the first line of treatment is the psychotherapist to maximize the result of completely resolving FND, especially for teenagers. So why not neurologist, right? So you must be thinking, well, it is a non-epileptic seizure and it's not epileptic seizure, so neurologist was the one who gave the diagnosis for my child, so the neurologist should be the one to treat. Not really. In this particular scenario of FND, the neurologist's job is to correctly diagnose what your child is having as an FND, but they don't really treat the condition. Once again, because it is a biopsychosocial phenomenon, the neurologists are not trained to be a treatment provider. They are a diagnostician, basically. So that's why they recommend go see a therapist. Sometimes they might say go see a cognitive behavior therapist or a therapist who specializes in CBT. Sometimes they might say a different type of therapist. Speaking of, what kind of therapist? Number one is psychotherapist or mental health therapist. Number two is physical therapist. Depending on what's going on with your child's symptoms and episode and severity and how long it's been going on and all of that stuff, your child might be needing a physical therapist. For the same token, your child might be also needing an occupational therapist or a speech therapist. But these are generally speaking different therapist categories. Of course, I'm a pediatric health psychologist, therefore I'm going to focus today's video on mental health therapist. So let's get to how to choose the right therapist. Because I was asked this question by one of the families who are currently in the program of Teen FND Academy. And it just dawned on me, oh my gosh, of course they wouldn't know how to find the right therapist, because if you're not in that industry like myself, how would they know? It's almost like that I wouldn't know anything about how to find the right kind of plumber. Kind of thing, that's my husband's job, so I don't know anything about what to look for, or looking for a car. Like, I have zero interest in driving a fancy car as long as it gets me from point A to point B. So I don't care about details or what is the good one or what is the best one. I just defer all of that to my husband, who is extremely interested in that kind of area. So for the same token, if you're not interested in or very geeky about what to look for in therapy, let alone for your child's FND diagnosis, how do you know, right? So I'm like, oh my gosh, yeah, of course. So I'm going to tell you what I taught to this family in my program. So I'm basically looking at three categories. Mainly it's two, but I'm going to break it down to three categories. Number one, no matter what, it doesn't matter whether your child has an FND or something else like anxiety, depression, ADHD. It does not matter what your child is struggling with. You have to have a therapist who can build a rapport with your teen, meaning your teen needs to be able to feel comfortable working with that therapist. Can you imagine that your teen is seeing the therapist who your child is not jiving at all, what is the chance of your child willing to work with this therapist who is going to suggest to your child what to do, right? So rapport. That is absolutely the foundation of what to look for. So assuming there is a rapport there, then the next thing that you absolutely have to look for is a specialist. So your teen may love this therapist that he or she is seeing weekly or every other week or however long. But if this therapist doesn't really know what she's doing, then what's the point? Again, we're talking about the resolution of FND. This is not the kind of talk therapy that your child can see just so she can vent and have this ranting session. That is not the goal of the treatment and therapy for FND. The goal of therapy and treatment for FND is to resolve FND. I mean, it sounds so obvious, but yeah, it's not just having the place and safe space to talk. Your child needs to learn the skills and strategies to resolve FND. So that's why you have to work with an FND specialist who knows what they're doing on top of building relationship. The third category, again, this is kind of related to the second one, is that because your teen is a teenager, your therapist or your teen's therapist also needs to be specialized in working with teenage adolescents age range, right? So again, not only that they have to know what to do with the FND, but they also need to be familiar with working with adolescent age range. So if the therapist says, I work with all this lifespan. The lifespan is a fancy word for saying, basically this means the therapist is trained to, quote unquote, work from anywhere between 0 to 100 years old. Okay? There are so many programs in schools and education, facilities that are mainly targeting to pump out therapists that are generalists. There's nothing wrong with generalists because think about it. If you are a generalist, then you're more likely to be able to serve, right, more people, obviously. But in this scenario, FND is such a specific problem. Therefore, you need to find a specialist that deals with that specific problem, let alone working with adolescents. The adolescents' age range developmental needs are very different from like infants or adults or geriatric population, right? Because mentally and developmentally, they're at this specific timeline. So the therapist needs to be able to know how to work with that. That also includes how to work with the parents. So if a therapist says a lifespan, that usually means 0 to 100, or maybe 0 to 200, whatever the age range is, right? But every therapist actually has a sweet spot. They may not say it exactly, or they might kind of keep it vague, but they always have this sweet spot. Not like a specific, I only work with 19-year-old, but like generally speaking, 16 to 25, years old, or young adults, college, age, whatever it is, they usually have a secret sweet spot. Which leads me to, if you are on a hunt to find a therapist for your child who's struggling with FND, these are the things you can ask. So I want you to ask these questions to sort of filter out, the right therapist, okay? So talk to your teen, first of all, about seeing a therapist and encourage the teen to have an open mind. Because at the end of the day, it's your teen who is struggling with FND. And no matter what, deep down, they want to be done with FND. It is so annoying, frustrating, so they want to be done. But there might be some sort of stigma or perception or impression about seeing a therapist, because that might mean that there's something wrong with them, or that means they're broken, or that means they think that it's all in their head, or stuff like that. So have a conversation about seeing a therapist. So usually the good place is, make sure that teen is also part of the conversation when a neurologist or a doctor recommends the treatment options, including therapy. So it's not necessarily coming from you as a parent, so to speak. And then included in the conversation is to have the open-minded for the teen. And little tweak here, let's just say if the teen is refusing, like, I don't want to go see a therapist or whatever, right? Then you as a parent need to educate yourself instead of pushing or forcing or making and coercive, right? So you as a parent need to educate yourself about the potential match for your child. So you kind of have to be on the hunt on your own without a team. And that's okay. You can go through the like a first round of filtering process, so to speak, right? But having the ongoing conversation, this is what we're doing. We think it's important. And whether you want to work with the particular therapist or not is up to you. However, we can search for these people. So that would be the step one. And then if you are to quote unquote interview a therapist for your child with FND, then the first question is this: are you familiar with FND? And or have you treated patients with FND? If the therapist says, I don't know what it is, then you have the answer, right? Next, move on. If the therapist says, sure, I have worked with them, then the next question is, okay, one, check mark. The next question is, do you work with teens, right? Or what is your sweet spot age range to work with in your practice? You can absolutely ask that question. If the therapist is huffing and puffing, like, well, I really work with, all age, that kind of thing. Well, that's one thing, but then you kind of go with the hunch and the gut feeling. If this is the kind of therapist you want to work with for your child. And if the therapist says, yes, I work with FND and I work with teenagers a lot, you can also ask, what is the percentage of your client who's got FND? So again, because chances are you're gonna be running into this generalist therapist more often than not. So you might have this therapist who is working with all of the other issues, including FND, but the FND can be like a teeny tiny portion, or it could be half of the caseload, or it could be virtually all of the caseload, kind of like me. So there is a variation to it, right? So make sure to ask, so what are the kind of typical percentage of your client who's got FND? You can also ask the same question. So what are the typical kind of percentage of teens that you work with in your practice, kind of thing. And then if you check all of those things, you can ask two more questions. One is, how do you treat patients with FND? So specifically, we're asking about modalities, like, do you use cognitive behavior therapy? Do you also include parent training? Do you also work with school? Do you also work with other doctors who are involved with your child's care? That kind of thing. So what are the typical modalities? Like, how do you typically treat the patients with FND, let alone teenagers? And lastly, but definitely not the least, what are the typical outcome of patients with FND? So let's just say that you met with a therapist and this therapist says, yes, I work with FND. Yes, I work with teens. Yes, it's pretty good chunk of the, caseload. Then what are the typical outcome? Like what happens when you work with your clients who have FND, and how do they end the treatment? I wouldn't necessarily ask how long it takes, because how long it takes really varies. So I did talk about this in my other video, that when you're stuck on timeline, then you're basically going to lose the game. So don't even worry about how long it's going to take, because it really varies. So with my case, the shortest time it took me to treat a patient with FND was like literally 3 weeks. 3 sessions, 1 week apart, and bam, that's it. Nothing more, completely resolved. But obviously that's like short end of it, because most of the cases it takes a lot longer than that. So time is not really a relevant question. And so those are the filtering out the questions to find a right therapist for your child. So let me repeat this. First of all, talk to your teen about seeing a therapist, right? And if the teen is refusing, at least you can do the homework. Number 2, ask this question: are you familiar with FND, or have you treated patients with FND? If the answer is yes, great, move on to the next. Next level, do you work with teens, right? What is your sweet spot age range in your practice? And what percentage of clients are struggling with FND? And how do you treat patients with FND? So these are modalities. And then what are the typical outcome of patients with FND when you work with them? So those are the typical kind of 5 questions with one extra. It's not really extra, but like the preliminary conversation you would have with your teen. And then somewhat irrelevant. So these are the questions I wouldn't necessarily need to ask because it doesn't necessarily matter when it comes to resolving your teen's FND. Number 1 is whether this therapist is doing in-person or telehealth. I'm not saying that you should be sticking with one or the other, but typically speaking, when we're talking about teenage age range, in-person telehealth, my experience anecdotally, the results are about the same. So this might be more of a logistics thing that you may not be able to find a therapist in your own area where you can see a therapist in person, blah, blah, blah. So I don't think this would be the main issue that you need to worry about. The main issue you need to worry about is this person specialized in FND and working with teenager. That is a far more important question than in-person or telehealth, okay? Number 2, I talked about this in previous video, but whether you're trying to use insurance company benefit to find a specialist or going outside of the benefit sort of network, it's really up to you, but there is a lot more cost associated with you being stuck on using the insurance panel because most of the FND specialists are outside of network. So if you're trying to be stuck on this insurance band camp and then trying to find a specialist who takes your insurance, I would say good luck. But this question is, in my mind, irrelevant because what you're after really is a resolution of FND, which is priceless because your teen, every day goes by, your teen is losing the time to be normal and healthy, and that adds up to a lot of stress. And as you can tell, for your stress as well. So to me, that is a priceless. It is an investment that you are looking for a return of that investment. You're not draining the money. And third question that I would say is somewhat irrelevant is the degree of this therapist. Now, I am a doctorate degree in psychology, therefore I have definitely a bias and have a caveat here. So when I say degree, I'm specifically talking about master's degree versus doctorate degree. When it comes to FND, this is a reality. I am definitely biased. Whenever you can, find a doctorate level clinician, right? Because they have a lot more years of experience and training and then specialties and things like that. However, with the FND as a context, you don't have that much luxury of, finding like 5-star hotel in Timbuktu kind of situation, right? And so as long as you are asking the right questions and then they are meeting all of the criteria, meaning they're familiar with FND, which is huge. And number 2, they can work with teens or they're specialized in working with teenagers. And they have a lot of experience because they have a relatively high percentage of clients who are struggling with FND. And their treatment is based on science and evidence. So it's not like a kumbaya, woo-woo thing, right? And then the typical outcome is pretty promising. Then if that person has a master's degree, but this is their specialty, I would say try it out, okay? That's why when it comes to FND and teens, those are more important questions rather than just the mere degree that this therapist has. Now, when I say caveat, that being said, I'm specifically talking about master's versus doctorate degree. I'm not saying whatever holistic therapist, right, or psychotherapist who you don't really know what kind of degree or background they have. I'm not talking about that kind of people, okay? I'm talking about at least master's and up level clinician. So just so you know that I'm not saying go see just about anyone, because it is true that it's kind of like you're navigating this like a killer sharks versus like a good shark, kind of thing. Because there are, unfortunately, some therapists and specialists who claim that they are specialists in FND, but what they do is totally not based on science and or evidence. So be on a lookout. That's why you have these questions you can ask to filter and then repel those kind of red flag providers. Okay? So I hope this was helpful for you to start thinking and looking through what is the right type of therapist. And speaking of the right type of therapist, have you checked the link down below? The American Psychological Association Division 54, the Society of Pediatric Psychology, has a special interest group. Oh my God, this is such a long thing. But there's a group of psychologists who are specialized in FND and pediatrics, that includes adolescents. There is a list of providers in that website. So I'm not saying I'm the only one on the universe. There are people like me out there. And I have to say, most psychologists, if not all psychologists, probably myself included, suck at marketing. So that's why it takes so long for a lot of families to find people like me. That's why I'm doing this, to disseminate the information and then awareness, so then people like us who are so passionate, almost obsessed to help teens with FND are out there. So don't give up, because there is a hope. And unlike adults who are struggling with FND, teens with FND are much, much more likely to completely resolve FND. So absolutely there is a possibility to be done with FND. And it's actually not that difficult. It's a lot of work and it's a hard work, but the outcome, the chance and odds of having a good outcome is pretty darn good. But the time is against you. So the sooner you can find, the sooner you invest, the sooner you commit to resolving FND for your child, the better the odds are for resolving the FND. Well, thank you so much for watching this video, and I hope to see you in the next video.